A crown is used to entirely cover or cap a tooth. Crowns are typically needed when large pieces of enamel break off of a tooth or large fillings break down. However, crowns are also used after a tooth has been root canaled to give it back its strength. And because crowns these days are made with 100% porcelain instead of metal, they look amazing. Technology has improved so that matching to existing teeth is better than it's ever been. The process is simple. It involves 2 appointments. The first appointment involves removing any old fillings or decayed enamel. The core of the tooth is filled back in with filler material. Next, the tooth is reshaped to allow the crown to fit between the neighboring teeth and into the bite. Once this is completed, an impression or digital scan is taken to capture a mold of the tooth. That will be sent to a laboratory where a technician will handcraft the crown. In the meantime, a temporary crown will be made and glued onto the tooth. The second appointment is a couple weeks later when the crown is back from the lab. The temporary crown will be taken off and the new porcelain crown will be fitted to the tooth. Once everything is perfect, the crown will be glued in, and that's it. The tooth is now restored and it looks awesome. This procedure is quite routine. Most patients simply get numb and get it done. However, talk to your dentist if you would also like to use nitrous oxide, it's also called laughing gas, or be sedated for the appointment. Either way is fine. It's just important for you to be comfortable. If you think you need a crown, we'd love to visit with you. Feel free to call, text, or email us anytime. Thank you.